This is a time of fasting now, not feasting. So people who fast during Ramadan must abstain from eating, drinking, use of oral medications, smoking from the pre-dawn to sunset time. However, there are no restrictions on food or fluid intake between the sunset and dawn. Most people consume 2 meals per day during this month, one after sunset and one before dawn. Many Christians too fast in different ways during this period of Lent. A series of complex metabolic, hormonal, and glucoregulatory mechanisms in the body accompany this transition from the fed state into the prolonged state of starvation. According to many studies on diabetic patients who also fasted, I want to highlight a few risk factors. The first risk factor associated with fasting in patients with diabetes is hypoglycemia. Severe hypoglycemia was more frequently noticed in patients who altered the dosage of oral hypoglycemic agents or insulin, and in those who reported a significant change in their lifestyle. Second was hyperglycemia. Hyperglycemia could be due to excessive reduction in the dosages of the medications to prevent the hypoglycemia. Patients who reported an increase in food or sugar intake had significant higher rates of severe hyperglycemia. The third was diabetic ketoacidosis. Patients with diabetes, especially those with type 1 diabetes who fast, are at an increased risk for development of diabetic ketoacidosis, particularly if these diabetes is poorly controlled before fasting. In addition, the risk for diabetic ketoacidosis may be further increased due to excessive reduction of insulin dosages based on the assumption that food intake would be reduced during this month. The fourth risk factor was dehydration and thrombosis. So a limitation of fluid intake during the fast, especially if it's a prolonged fast, is a cause for dehydration. Dehydration may become severe because of the excessive perspiration, especially during this period, which is a hot and humid climate change. Among individuals who perform hard physical labor also, dehydration can be a risk factor. In addition, hyperglycemia contributes to volume and electrolyte depletion.